In this video, we're going to go through the muscles of the thigh and the knee area. Just a reminder for these, I won't go through exact attachment sites, i.e. origins, insertions and actions throughout this practical demonstration video. I'll refer to some attachments and definitely the location of the muscle, but just a reminder there are plenty of resources for origins, insertions and actions in the resources tile and also the weekly tiles of this Moodle page. We're going to start off the palpation for this region with the rectus femoris. This is one of your 4 quadriceps muscles, and you'll note that there's only 3 quadriceps muscles that we can palpate, hence they're on your palpation sheet. So we're going to start off with rectus femoris. You'll learn how to palpate the origin for this in the hip and pelvis week. So next week, however, this originates at the anterior inferior iliac spine, which is on the pelvis. So on Barry, what I would do is I'd first of all find the iliac crest towards the ASIS, and then from that I would have the anterior inferior iliac spine. That's where the muscle is going to start, and it's a very central muscle on the anterior thigh. So it's going to track down centrally over the patella and then terminate on this tibial tuberosity here. So it's quite a long muscle, okay? And to activate that, you can either flex the hip or you can extend the knee. So for all quadriceps, a really good thing to do to surface mark them is if I just get my model to bring their knee into the couch, okay, and really squeeze that quadricep, that's it, and we can see a few of the quadriceps muscles here. So that's rectus femoris to surface mark, so I can palpate anteriorly, I'd be able to feel that muscle, okay, before it becomes a tendon towards the tibial tuberosity. Vastus lateralis attaches from the lateral lip of the linea aspera on the thigh. So on the thigh here, we can start to palpate a little bit higher up here. Again, you can keep that muscle contracted. So by just generally contracting your quadriceps, laterally, you can see we've almost got a second teardrop muscle here, especially where there's someone with good definition in their thigh. You'll be able to palpate that quite well. So lateral lip of the linea aspera down towards, again, anterior knee towards the tibial tuberosity where that attaches. The vastus medialis has a similar origin and insertion, but rather than the lateral lip of the linea aspera, we're now looking at the medial lip of the linea aspera. So that tracks more medially, and again, if you can get the client to squeeze their knee into the couch, downwards towards the medial aspect of the thigh. We've got this teardrop muscle on the medial aspect of the thigh, which I can palpate quite well on Barry here, downwards towards the tibial tuberosity, where that becomes a tendon. And if you relax there for me, please. From the vastus medialis, we're still going to palpate another muscle, which is on the anterior thigh. This sartorius muscle is the longest muscle in the body. So it attaches from the ASIS, which is your anterior superior iliac spine. So it attaches higher than rec fem, proximally, and then distally it attaches lower than where rec fem inserts. So from the ASIS, downwards towards the pes anserine, which is actually on your tibia, that's where that whole muscle attaches, and it tracks down medially onto this tibia. It has got quite a few actions. So at the hip, it will flex, abduct, and externally rotate, but at the knee, it will flex and internally rotate, okay? So just bear that in mind. What you can do is, again, you can get the client to extend the knee to reveal the quads, and you know it's just going to fall underneath that vastus medialis as it attaches distally onto the tibial tuberosity, okay? Or you could get the client to flex the hip. So if you go to bring your knee up towards your chest and flex up for me, you know that there, as it's a flexor and abductor, we can palpate the sartorius onto the pes anserine, which is actually here on the tibia. Okay, so that's your sartorius muscle, C-shaped muscle that attaches downwards towards the pes anserine. The adductor group, these all attach from the pubis, which is the anterior aspect of the pelvis itself. So this is the origin of where the adductor group are. We've got quite a few adductor muscles. So for example, we have the longus, brevis, the minimus. We also have the pectineus and gracilis. And this group of muscles, they all attach from the pubis, so we wouldn't palpate that on our clients. But what we can do is we can get them to adduct, so adduct, which means the leg moves towards the midline of the body. So what I'd like you to do, Barry, is I'm going to place my hand on the inside of your ankle. If you could just resist and don't let me move you, okay? Perfect. And then what I can do is I can feel all of the adductor muscles contract as he's resisting isometrically against my force. Thank you very much, okay? So all of those muscles go from the pubis and they attach onto the femur at some point. So whether that's gracilis or magnus or whatever muscle. And then we also have an attachment onto the adductor tubercle. So that's the adductor group all across here. We then also have the iliotibial band, so the IT band this is sometimes abbreviated from. And this attaches from the anterior aspect of the ilium, and it tracks down laterally onto the anterior lateral tibia, which is here, okay? So if we first of all palpate the iliac crest on your client, finds the anterior aspect, we know that the iliotibial band will attach from here, mainly the tensor fasciae lata. So we've got the TFL, or tensor fasciae lata, which attaches from here. Once you have the TFL, it then blends into what we call the iliotibial band, which isn't a muscle, it's another structure, almost like a taut structure, similar to layer of fascia, which separates the anterior to posterior thigh. Okay, so laterally, if you're halfway and you're central on the lateral thigh, you will find this iliotibial band. It doesn't feel like a muscle, so there's no point trying to contract it, but you can feel this iliotibial band on the lateral aspect of the anatomical thigh towards the tibia. And that concludes the anterior, lateral and medial aspect of the thigh. We're now going to look at the muscles of the posterior thigh. So these will be the hamstring muscles. And these hamstring muscles all originate at the ischial tuberosity, okay? So just bear in mind, it's really important when it comes to informed consent. I've already gained informed consent from my client as the model today. However, for the purposes of demonstration, it might sound something like this. So Barry, what I'm going to do here is I just need to palpate, which means to feel the hamstring muscles on the back of your thigh. These muscles originate just by what we call the gluteal crease, okay? So just at the bottom of the glutes. Are you okay for me to palpate for the purposes of pain and just to check for any injury in that location?
Yes.
Yeah, perfect. Thank you, Barry. So centrally, this is where we're going to be able to palpate the proximal hamstrings. So you can either look for where the inferior aspect is, so the gluteal crease, and on some people that might be quite evident. Alternatively, what you can do is you can find the greater trochanter, which is what we're going to palpate in the hip and pelvis week, so next week's lesson, which is where you're going to rotate the femur. You can feel the greater trochanter quite nicely there, and then in line with that and slightly inferior, you can then, if you're central on the thigh, you'll be able to find the ischial tuberosity. Okay, that is the origin of the hamstrings. They separate though distally for their distal attachment. So do have a look in more detail at some of the other resources that we have on the Moodle page for the hamstring insertion points. But broadly, we have laterally the biceps femoris, and medially we have the semimembranosus and the semitendinosus. So as a group, we can get the knee to flex. So bring in the heel up towards me and don't let me move you, Barry. Fantastic. And I can really feel the proximal tendon on the ischial tuberosity here. And then if I want to, if you push up against my hands, I can feel the biceps femoris laterally towards the tibia, or I can feel the semimembranosus or the semitendinosus distally, okay? You will feel the tendons here as well. So biceps femoris tendon here is quite prominent. And then if you relax there, Barry, we can then feel that on the medial side as well. So if you push up again, you'll feel two tendons this side because we've got the semitendinosus, which is much more prominent as a tendon. And then we have the semimembranosus as well. And just relax. One other thing we can do to isolate it further is whilst the hamstrings will extend the hip as well, we won't demonstrate that now, but it will mainly flex the knee. If I wanted to bias the biceps femoris more, I would add in an element of eversion at the foot to resist, which is external rotation of the knee. So whilst I'm pushing up here into knee flexion, he's also resisting into eversion here, and I can really prominently feel that tendon and just relax. I can then do the same thing on the other side, so push up and push in towards my hand, and and you've got semitendinosis and semimembranosis.